many people think about brain tumors with respect to the tissue as dead, it doesn't function, or it doesn't belong in your brain. But the truth of the matter is that much of the brain is there for a reason. And when the brain reorganizes, sometimes it reorganizes so that there's function in the tumor. So we've studied that a couple of different ways. And I'm just going to show 2 slides on this concept. And I'm going to show that you can measure neural responses in the brain and look at both tumor regions, meaning regions that are infiltrated with a brain tumor like a glioma, and areas that are not involved with tumor. And you can look and see what the neural responses look like, the amount of neurons that are firing when you have a person perform a task such as speak, when separating out tumor areas and non-tumor areas of the brain. So if you look here, these blue dots represent normal tumor regions and non-tumor regions of brain. The red dots represent tumor regions or glioma-infiltrated regions of brain. And you can see here, this plot is called an entropy plot. It's a way of measuring the amount of information that's encoded in the neurons that are in these areas of the brain. And put differently, you can see that the amount of information that's embedded within the tumor regions of brain is less, but not zero, where the amount of information encoded within normal regions of brain is much higher. So both regions actually have information encoded within those neurons. When the neurons fire, they're transmitting information to different parts of the brain, just transmitting less efficiently within tumor regions of brain. And these are important caveats because we know that patients do better with less tumor in the brain. And so surgery to remove is an important consideration, that it has to be done in the context of these important findings so that we understand exactly what we're removing and try to do it the safest way possible. This is another way of looking at this. So you can look at tumor-infiltrated regions of brain, and you can look at the encoding capacity. That simply means that if you have somebody perform a relatively easy task, such as, let's use the naming, for example, and I want to say a monosyllable word, like a pen, and compare that to a highlighter, right? The amount of neurons that have to fire for me to say pen are fewer than the amount to say highlighter, which is a polysyllable word. Within our tumor regions, within the area of brain invaded with tumor, those neurons can't come up with enough of firepower to generate the highlighter, but they can come up with enough firepower to say pen, the simple task, the simple part, the monosyllabic one. So yeah, I'd mention all this to say that within tumor-infiltrated regions of brain, there is function in there many times that has to be considered. You use functional mapping to remove these regions so that we can make sure we're removing the bad part, but keeping the good part. The function you find within these regions is not as intricate and as detailed as in the non-tumor regions of brain. So again, important considerations when we think about how to safely remove brain tumors.